turbo engine running.
Absolute genius.
Get this.
Welcome.
This is the show where we bring you
Science.
What that essentially means is
discoveries,
Advances.
Questions. Research.
technology. Unbelievable.
Without further ado,
This is The Naked Scientists. Hello, welcome to this week's Naked Scientists podcast, the programme that strives to bring you the biggest breakthroughs and talk to the major movers and shakers from the worlds of science, technology and medicine. I'm Chris Smith, and coming up, the new drug that cures mosquitoes of malaria. Intrigued? You'll see why scientists have done this in just a minute. Also, the Microsoft AI system set to revolutionise weather forecasting so you can plan that barbecue with impunity in future, and 150 years of the metre, kilo and second, how science finally agreed on a definition for some of our most important units.
From Cambridge University's Institute of Continuing Education, this is The Naked Scientists.
First this week, for decades, insecticide-treated mosquito nets have served as a frontline defence against malaria. But their effectiveness is waning as mosquitoes develop resistance to these agents. What if, though, instead of targeting the mosquito, the disease's carrier, we targeted the parasite itself inside the mosquito? In a groundbreaking new study, researchers have identified compounds that can do just that, killing the malaria parasite inside the mosquito within just minutes of contact, and doing it by getting into the mosquito from things it touches. It's a bold and innovative approach that could transform how we halt malaria transmission. Alexandra Probst at Harvard University is the brains behind the project.
We have a couple of different tools that we use to really try and combat malaria, one of which is killing mosquitoes with insecticides, the mosquitoes that transmit malaria to people. Unfortunately, although those tools have been really effective in the past, their really extensive use has led mosquitoes to adapt and develop ways to survive that insecticide exposure. So insecticides are no longer killing mosquitoes, and we need a new way to target the transmission of malaria other than just killing mosquitoes themselves. And so our idea was really to target the parasites within those mosquitoes and stop transmission that way.
So you dose the mosquito and kill the parasite?
Yep. That's right. So in humans, of course, we can treat people with anti-malarial drugs, and we wondered if we could basically do the same things to mosquitoes and treat them with anti-malarial drugs to cure them of their parasite infection.
How do you dose a mosquito, though?
Yeah, no, it's a good question. We obviously can't, give them a little pill, but we really do this by treating the surfaces that they land on so that they can take the drugs up through their legs. So we've mostly focused on treating bed nets, for example, and that provides both a physical barrier, so the mosquitoes can't get to you and bite you, but when mosquitoes land on that bed net, they can also come into contact with drugs. So this can be an insecticide that kills the mosquito, or in the context of insecticide resistance, where mosquitoes are no longer dying, it can be an anti-malarial drug that treats that mosquito and kills the parasites within it.
Is that really an efficient way to get drugs in then? Can it go in through the legs to any appreciable amount or degree?
Yeah, it's actually a really good question, because we did this screen of over 80 anti-malarial drugs to basically try and find compounds that could both kill the parasite and effectively get into the mosquito through its legs. So we were looking at those two key parameters. And we did find some really promising compounds that we were able to show got in really effectively through the sort of waxy cuticle of the mosquito legs.
How much contact does the mosquito have to have with the bed net then? Is it sort of just a brush pass that's enough, or does it got to sit there and dwell for some time for enough of the agent to get in to actually sterilise the mosquito and get rid of the parasites?
That's a good question. We have primarily in the lab tested this by allowing mosquitoes to land on these treated surfaces for a couple minutes. And that sort of approximates the amount of time that they would actually land on a bed net. Because normally when a mosquito is searching for a blood meal, it will be attracted to the person sleeping under that bed net, and then it reaches this barrier and it can't get to that person. So it actually hangs around on the bed net for a long time, sort of moving from place to place, trying to get at that person sleeping underneath. So we think that this couple minutes exposure seems to be just enough time to really get a lot of compound into those mosquitoes.
And does it sterilise the mosquito, as in, does it wipe out the parasites on board? Can you prove that?
Yeah. So parasite development in a mosquito takes about 2 weeks. So there's actually a bunch of different stages of the parasite during that time frame. And what we've shown is that it completely sort of sterilizes the mosquito in terms of its parasite infection. If you have this exposure and then an infectious blood meal, or if you have an infectious blood meal and then shortly thereafter an anti-malarial drug exposure. So it really completely kills those initial stages of infection in the mosquito.
Why stop at bed nets then? Could not I spray this on, because I know mosquitoes will go for my ankles, my elbows. Those are the characteristic sites, aren't they? Can't we spray this on people as well?
Yeah, that's a good point. We haven't really looked at applications directly for a person, but I think there's no reason to think that that wouldn't work. We've shown now that these compounds can be taken up from a couple of different kinds of treated surfaces, so I expect that would work on a spray for people as well. Another possible application is spraying walls or ceilings inside people's homes. And this is also done currently with insecticides. And the reason for that is that it's a lot more long lasting. So, you or I might take a shower at the end of the day and then wash off that anti-malarial drug, whereas it can stay coated on a bed net for many years or on a wall or a ceiling for many months up to a year. So it's much longer lasting that way.
What's the environmental safety like, though? Because we're very worried about things we're going to put into the environment. DDT taught us a very painful lesson in this respect. I know that's an insecticide, but is this specific just to the mosquitoes? Will it have off-target effects? How safe is it, effectively?
That's a great question. Yeah, so that's something that we're actively working on right now. This initial work was basically just to show that it has really good anti-parasitic activity in the mosquito. And now that we've got these really promising hits, we're actually starting to do a lot of this initial safety testing. So far, everything's looking really good. And I think that one of the major benefits of this approach over, say, other insecticides is that it's actually extremely parasite specific. So we've got a really good therapeutic index for which basically means how much drug is needed to kill the parasite versus how much drug could impact people. So we have a really wide range between those two doses, which means that the amount that we need to actually kill parasites is most likely not going to have any impact on people. This requires years of safety testing, so we're still doing this, but all signs look really good right now. And because it's parasite specific, we're not going to be having off-target effects on other insects. So for example, other insecticides might impact important pollinators, but this approach would not do that.
There are 4 or 5 different types of malaria that hit humans.
Yep.
Will this work on all of them, or is it specific to just one type?
Yeah, so far we think that this should work on all of them. So in this study, we were looking at Plasmodium falciparum, which is one species of human malaria. And this is the parasite that causes over 90% of human cases and deaths worldwide. So we've shown really rigorously that it works against the most important agent of malaria. But we've also begun testing this with partners in some other Plasmodium species. And this was not in the paper that's coming out, but it's also looking really effective there. So the parasite target of these drugs is shared between these different species. So we think that this should be effective against all human malaria.
Ali Probst at Harvard University there. Wonderful news. That study just out in Nature. Now, when they're not busy sending out inopportune updates to their Windows operating system, Microsoft have been beetling away developing an AI system that they claim can knock traditional weather forecasts into next week. The model, which is called Aurora, is 80% more accurate than the current best-in-class systems, and it can even work out measures of air quality and tropical cyclone paths. Moreover, it does in just minutes on a desktop what our existing electricity-hungry supercomputer systems take hours and megawatts to achieve. Paris Perdikaris is one of the architects of the system and an associate professor at the University of Pennsylvania.
The existing methods are very sophisticated. They have been developed over decades, and everything started with the advent of computers in the 1950s. So certainly we have come a long way, and we are at the point that we can simulate those systems using first physical principles. Using those concepts, we have mathematical theories and models that allow us to describe how the atmosphere evolves and how the weather evolves. The challenge here is that in order to make those predictions, we have to pay a price and we have to use dedicated large scale computers. And also, the development cycles and the maintenance cycles of those systems is very expensive. So, this is one of the key points that artificial intelligence methods are trying to change and help us develop tools that are very accurate, but also at the same time a lot cheaper to use and a lot more accessible.
So why can a machine learning or an AI approach do what it currently costs us massive amounts of electricity and computing grunt to achieve to make these predictions then? How do you foresee you can improve on that?
Systems like Aurora excel because they learn from patterns in actual data rather than trying to solve complicated physics equations. So, one of the key innovations here is that Aurora first learns general patterns about how the Earth system works from millions of data points, building a foundational understanding of how the atmosphere evolves. And then, in a second stage, it can efficiently teach itself specific tasks like how to track hurricanes or how to predict air pollution by recognizing subtle patterns that traditional models might miss.
And if you do a sort of head-to-head comparison, which you have the benefit of doing because obviously we've got the past data for the Earth system, so you can ask what would models predict would happen and what did happen, how good is it compared to both what reality taught us happened and also what our own existing best systems said would happen?
Right. You can observe improvements in accuracy by almost 50 to 80% compared to traditional systems. And all that comes with a significant boost in computational cost and acceleration in terms of how those predictions are being obtained. So instead of operating a supercomputer for hours to generate a 10-day forecast, now this can be done on a desktop computer, basically consumer hardware, within a minute.
Is it equally good everywhere, though, Paris? Because obviously some bits of the world, if we take the UK, for example, we've got resolution of data across our country down to less than a kilometre, that we know what's going and we can make really good predictions. But if I go to a patch of the Indian Ocean where there isn't very much information because very few satellites pass over, hardly any instruments are there, the data is much more sparse. So can it compensate for that, or do you acknowledge there are going to be places on Earth where it's not quite so good?
Right, that is a great question. And in fact, while observational data, as you described, can be very sparse, especially in parts of the world that are underpopulated or remote, we have access to the traditional tools that have been developed over decades that allow us to make forecasts at a global scale at fairly high resolution in the order of a couple of kilometers. And this is the kind of data that also goes into the training of these AI systems that to some extent help us address this issue of data sparsity.
And presumably, once you've got that robust foundation making these sorts of predictions at the bottom, you can bolt on all kinds of other things that we know are driven by that system, but are a product of our activities. Pollution, for example. Once you know where the air currents are going, you can predict where we're likely to get pollution hotspots. You could predict floods. You could much better predict other catastrophes. So it presumably makes us much better at reacting to problems that are coming down the track.
That is right. In systems like Aurora, you can think of them as working a bit like a brain that is constantly learning. So first comes a general education phase, where the system learns from millions and millions of hours of Earth system data. So everything from temperature and wind patterns to ocean currents and so forth. And during this phase, the model is trying to build its own neural connections that understand those fundamental patterns, how warm air is rising or how pressure systems move. And this is done using a sophisticated deep learning architecture we call the transformer that can understand information at multiple scales simultaneously. Once this general education phase is done, then comes a specialization phase where the model is fine-tuned to excel at different prediction tasks, similarly to how you might specialize in particular subjects after general schooling. And the remarkable aspect here is that knowledge transfers between the different physical domains. So, for example, what Aurora learns from atmospheric physics, it also helps it understand how air pollution is transported or how hurricanes are developed and evolve.
How future-proof is it, though? Because you're using past data to work out what might be happening in the short term, but we know that the Earth is a changing and dynamic place. We know that climate change is going to mix things up. So can you compensate or account for that?
Indeed. So, as things are evolving and the climate is changing, I think that will require us to update those models periodically. The good news here is that weather and climate evolve at different timescales. So, when we're talking about, a 10-day weather forecast, that spans a short period of time, whereas the climate is evolving over scales that take years or decades to develop. And of course, every couple of years or every decade, we would need to update those AI systems to better track the change in statistics in the climate. Of course, there's also challenges in those shorter timescales, and I think one prominent challenge is how do we handle extreme weather events? And I think this is a challenge both for AI methods and traditional models. Models like Aurora benefit from being trained on diverse data sets that span many years and diverse climate conditions, but unprecedented events still remain difficult. So that's why ensemble approaches are typically employed to quantify uncertainty associated with the predictions that we're making, but also keeping humans in the loop for critical decisions and for model evaluation.
Paris Perdicaris at the University of Pennsylvania there, another great story in Nature.
The Naked Scientists podcast is produced in association with Spitfire, cost-effective voice, internet and IP engineering services for UK businesses. Find out how Spitfire can empower your company at spitfire.co.uk.
Music in the programme is sponsored by Epidemic Sound, perfect music for audio and video productions.
This is the Naked Scientists podcast with me, Chris Smith. Still to come, how scientists came by the metre, the second and the kilo 150 years ago this year. But first, Cambridge scientists have developed a promising new treatment for the most common childhood cancer. The approach combines two drugs to target B-cell acute lymphoblastic leukemia, or B-ALL. Simon Richardson from the Cambridge Stem Cell Institute noticed that cancers carrying a mutation in a gene called CREB-BP produce much more aggressive disease. But by introducing this change into cancer cells grown in the lab, he was also able to find that they become exquisitely sensitive to a certain chemotherapy drug called venetoclax. And he then found another drug that can put all cells into this same sensitive state, not just the ones with the mutation. So, by dosing a tumour with both agents, you can kill all of the cells. It could, if the forthcoming clinical trials work, significantly cut treatment regimes and improve remission rates for people with the disease.
B-ALL is a highly aggressive cancer of B-cell immune cells in the bone marrow. These cells normally would go ahead to produce antibodies in your blood to protect you against infection, but they're too primitive to actually be useful, so they build up in the bone marrow, stopping you from producing normal blood, which is very dangerous, can make you have infections, tiredness and bleeding. And then they can move around the body and they can enter places like the brain where they can hide from chemotherapy.
And how do we currently try and manage the condition?
So the good news is in children, this is a treatable condition, but the treatment is 2 years of chemotherapy, so it's quite intensive. So the majority of children are cured, but as you get older, the treatment becomes more toxic and less effective. And unfortunately, in adults, we end up using bone marrow transplantation for the majority of adults, and it's got about a 50% cure rate. So we need more effective treatments, particularly for adults, and kinder treatments for children.
So have you progressed towards that? What have you actually been doing?
So we were very interested in a gene called CREB-BP. This gene was picked up a few years ago as being associated with resistance to chemotherapy and is highly enriched in patients who relapse with this disease.
Oh, right. So this is a marker that if they've got that particular change to that particular gene, it's probably bad news for the disease.
Yeah, there's something about this gene that this disease really likes, and it makes the cells much more resistant to current treatments like chemotherapy.
Was you thinking then that if you can get underneath what that gene's doing, then that may unlock a better way to treat it?
That's right. So what we did was to take cell lines that were derived from patients with this leukemia, and we used a genetic engineering approach to introduce this mutation into those cell lines. So we had cell lines that just differed by this one mutation.
As in, when you say cell lines, cells cultured in a dish, you're engineering in that change. So you basically have got in a dish what would be going on in that patient's bone marrow.
Exactly. One leukemia from one patient split into two, one with a mutation, one without.
How do you then use that to work out how to manage that disease better then?
So we started looking at the differences between these cell lines, and in particular for this project we were looking at how they responded to different drugs. And the big surprise to us was that these cells became really sensitive to a drug called venetoclax.
What does that mean in terms of therapy?
We found that there was another drug called inabrodib, and that drug can actually mimic the effect of this CREB-BP mutation. And when we put that on the cells, although they didn't mind it in itself, it made them much more sensitive to the venetoclax.
That's ingenious. So you're basically mimicking the effect of the mutation with the other drug, which is a bit like sort of something that opens the door so that the other drug can lob a bomb in and blow the cell apart. So you use a 1-2 punch almost like that.
Yeah, so it's either we call it synergy or sensitization, depends on whether the cells are already sensitive to it or not. But it works across all sorts of different genetic subtypes of ALL. We think it will mean that many more patients can benefit from venetoclax and for much longer. And we've got it to a stage where we'd be interested now to test it in patients.
And is that what is on the cards?
Yep, so we have applied for clinical trial funding to test these two medications in adults and in teenagers.
One of the problems with cancer is that it mutates. It evolves all the time to sidestep the immune system, to sidestep drugs. So what's not to say that it won't just sidestep this? You might buy some time, but after a while we're back to square one.
You're totally right. So the key with cancer is to target different ways of killing the cells. And the current treatment that we use is chemotherapy, which targets cells that are cycling very quickly. And we use immunotherapies, which target the immune system against these leukemic cells. The really attractive thing about this particular approach is it's completely different to either of those and potentially quite complementary to them as well. So that might allow us to reduce the doses of traditional chemotherapy, therefore reducing the toxicity.
Some great news there. Simon Richardson from the University of Cambridge, and that study has just been published in Nature Communications. On the 20th of May in 1875, 17 nations came together in Paris to throw out centuries of chaos and contradiction and build a universal language of measurement. Today, we take the idea of the metre, the kilogram and the second very much for granted. But before the groundbreaking metre convention, units of measurement were defined by monarchs and markets, not by nature itself. 150 years on, though, that quiet revolution still shapes everything from the smartphone in your pocket to the satellites above your head. And to tell us how it happened, here is Alan Bruin, who's the Science and Engineering Director at the National Physical Laboratory.
Well, if you go way back in time, there was a real problem with science, which is that everybody would measure things in their own ways. They'd use their own measurement systems and, strangely, even use parts of their body as frames of reference. So, for example, in ancient Egypt, people would talk about cubics, which is the length of an arm, and lots of people will recognise the term hands for measuring horses. But everybody used their own system or their own way of doing that. And it wasn't until 1875 when that changed and scientists from around the world came together and agreed to use one set of measurements and a system to support them and to make them work.
That sounds like a nightmare. The Industrial Revolution spans and predates all that. So you're saying that people were building, say, James Watt's steam engines and steam trains and so on, and they were using their own definitions of units and scales when they did all that engineering?
Yes, so it wasn't the case that nothing works, right? Lots of things did work, and it worked much of the time because people would communicate, they'd fix errors along the way. So it wasn't that nothing worked, but there were much more efficient ways to do it, and so much wastage around changing one unit to another or fixing errors or wastage in processes. So things didn't always work, and so a unified system was seen as a way of eliminating all that waste and all that risk.
How did the individuals who came together to come up with that unified system decide what measures they were going to regulate or stipulate to make them international units? How did they decide that list?
So as you can imagine, it was a monumental committee exercise. Think about the UN or these kind of large committees. So it wasn't quick. I suppose the principle would be that they looked at the units that they needed to essentially describe the physical world in its entirety, right? So the SI system that we think about today, and we don't even think about it actually, it's so ubiquitous. We use it without thinking about it. So if you pick units like the second for measuring time or the meter for measuring distance, kilogram for mass, it feels like they've always been there, right? But actually, they really had to think about this. There were 7 units that they described that, when tested, described the physical world in its entirety. So all the measurements that we use today to cover aspects of modern life are covered by those 7 units.
I can understand how you would do it for a meter, because you could have a physical thing that you could say, well, there you go, that's a meter. I can understand how you could do it for a mass, like a kilo, and Le Grand Kilo. It's in Paris, isn't it? That huge chunk of metal that is the kilogram.
Yes.
How did you do it for time, though? Because surely the inaccuracies in keeping time must have been quite tricky to surmount. Or were they just really very good metrologists by then?
Originally, time was measured with reference to celestial bodies and things in nature that human beings could refer to and understood. But of course, there's variation in those. And as technology moved on, we need more and more accurate measurements. Nowadays, we measure time against fundamental properties of nature. But what happens is an ion is trapped in very complicated engineering, and we trap an ion and we excite that ion, and it gives off radiation at a certain frequency. And that frequency is the same wherever that atom is in the world. And provided you do the right things in the right way, it gives you a very consistent and accurate frequency of radiation. And you can use that instead of, you think about the ticking of a clock, you use that atom as the ticking, and that becomes your point of reference. In 1955 at NPL, Louis Essen developed and demonstrated the first accurate cesium atomic clock. So that atom was cesium in that case. And actually that stayed as the point of reference for the second since that point.
NPL came along in 1900, so that's 25 years after this all got started. What was the motivation for having the National Physical Laboratory? What was its role, and what does it still do?
NPL was established by Prince Charles at the time, who talked about the interface between science, technology and industry. It's actually 125 years since NPL was established. And we're celebrating that at the moment with some open events. About 2,000 people are going to be coming to NPL to see what we do here. And we're celebrating our past, our present and our future.
And what will visitors to the open day potentially be treated to?
They'll be able to talk to the scientists and engineers, I think is the primary thing, and really ask open questions and see where the work is done. We're going to be celebrating all sorts of things around our history. So the work that Alan Turing did here with the ACE computing engine, which was the forerunner of modern computers, the atomic clock work that I mentioned previously, even things like packet switching, which Donald Davis developed here in 1965, which is one of the underpinning principles behind the internet. So there's lots of things around our past. People will be able to see the things that we're doing now and the impact we have now, the accurate atomic clock. So it's a room full of wires and electronic equipment that, it doesn't look like a clock that you might have in your head. But that's fascinating to see that and speak to the scientists there and understand everything that it takes to make a clock that is that accurate. These clocks now are heading towards an accuracy that if you were to run it since the beginning of the creation of the universe, it would still be accurate to within about a second.
But we still can't make the trains run on time, although that is not the fault of Alan Bruin at the National Physical Laboratory. And interestingly, our relationship with NPL goes back nearly 20 years, we realised during that chat, because back then, when the online world Second Life was just getting started, we at The Naked Scientist teamed up with the NPL team to make a Naked Scientist mansion where avatars from all over the world would get together in Second Life on a Sunday evening to listen live to the programme. And we know that some of them are still out there listening to us today. Hello to all of you. NPL will open their doors to the general public on Friday the 6th of June. It's just £3, which is all donated to charity, and children go for free. Check out their website for more details. Now it's time for Question of the Week, and James Titko has been taking on this quandary from our listener Darren.
Hi everyone. My question for this week is, why can we still see the light from the early galaxies? Why hasn't that light already passed us when it was from so long ago and the universe was so much smaller? Thanks. Bye.
Thanks, Darren. Lovely question. When cosmologists gaze into space, they're looking at the stars and galaxies as they were long ago. This is because light travels at a finite speed, and given the huge distances it has to travel to reach our telescopes and eyes, it's often taken millions of years to reach us. In addition, and crucial to your question, Darren, the universe is expanding. Here's Daniel Whiteson, particle physicist at the University of California in Irvine.
I think Darren's question makes a lot of sense if you think of the universe as emanating from a single point in space, where everything blows out. And then you can wonder, like, hey, the early universe galaxies, their light should be zooming away from us and they've already passed us. How can we see it, right? And so it's hard to understand this. But that's not the scientific understanding of the early universe, because matter was always everywhere in the universe. So the Big Bang, this expansion of space, was everywhere. We don't know if the universe is infinite. We don't know if it was infinite, but there's no center or special place that the expansion is happening from. It's happening everywhere. The universe was once filled with very hot plasma and was later filled with young galaxies. So there's always a young galaxy at the right distance to be sending us photons for it to arrive right now.
Almost exactly a year ago, scientists reported on the earliest and most distant galaxy we've ever observed. Using the James Webb Space Telescope, JD's GS Z14-0 was glimpsed as it was just 290 million years after the Big Bang. Now, given the universe is 13.8 billion years old, this was very young indeed, and the reason we can see it at such an early stage of development is exactly because it is so far away. What's more, at the periphery of the observable universe, scientists see that it's expanding faster than the speed of light. Eternal Student on our forum has a useful analogy for this. They write, you might imagine a hare running as fast as it can down a road, but someone has been stretching that road faster than the hare can run. But what does this mean? Here's Daniel again.
If the universe weren't expanding, we could continue to see galaxies forever into the future, right? Because it would always be more young galaxies in the early universe for us to see, this ever-expanding slice of the universe that we're seeing. But because everything is moving away from us, and at great distances it's moving away from us faster than the speed of light, then eventually we'll run out of those galaxies to see. And in the far, far future, our ancestors won't be able to see young galaxies. They'll just see a dark sky.
What a time to be alive. Thanks to Darren for setting us off on that mind-bending journey, and to Daniel Whiteson from the University of California at Irvine, who also has his own podcast, Daniel and Kelly's Extraordinary Universe, where you can hear them answer more questions like this on space, black holes, and even brains and maggots. If you have any thoughts, why not join in on the forum discussion like Eternal Student over on nakedscientists.com/forum. Next time, we'll be answering this question from listener Mark. Does the lack of oxygen in planes contribute to jet lag? And if it does, do you get jet lag if you fly somewhere with the same time zone?
And as James mentioned, you can join the conversation at nakedscientist.com/forum. You can also email any questions or answers to chris@thenakedscientist.com. That is all we have time for today. Do join us on Tuesday, though, when we're going to hear from leading autism expert Sir Simon Baron-Cohen. He's our titan of science. The Naked Scientist comes to you from the University of Cambridge's Institute of Continuing Education. We're also supported by Rolls-Royce. I'm Chris Smith. Thank you for listening, and until next time, goodbye.